double check. But I think it's
Okay.
just like any test. This was done on the fly a little bit, so we'll look at it.
Okay.
So don't
Okay.
worry.
Sounds good.
This test is more your self-guide to make sure you're on the right track. It's not going to add to your score at the end.
Okay.
This is more open learning. There's no need to worry. It's an open learning method because you ask questions. We all learn different ways. This is one way some people learn is asking a question, answering, and checking. Some people
Hello,
check while
Devendra bhai.
answering. Yeah.
Yeah, okay. Now you can start, okay, because recording has already been in progress, so
Okay.
you can
Okay. We can start. Okay.
Yep.
So today's talk is going to be basically the basis behind the talk yesterday, which was well presented on Carrot Circles. There's some overlap because we're obviously going to talk about cards again. Some of the topic was mentioned yesterday. The purpose today is to give you a feel of the basis from a more of a scientific perspective. Now, when it says scientific here, it's not going to the level that we'll talk about later when we get to diseases. We'll go into more detail, like stress. It's more overview. There's a guidebook that we have on Prekshadyan, which we'll share with you all. The copies being made, so we'll give them to you. And so we're sticking to that as a basic process. So some of this is very basic in a way. It's more lingo you might use to talk to people rather than what you may yourself know. So this is what we're going to talk about today. So it's lighter in some keynotes, but thereafter we'll go deeper when we talk about the medical talks. So really, what we're going to do today is to try and understand at that level stress and its bodily or physiological mechanisms. And we're going to talk about disease and cause of tension, which we touched on yesterday. Relaxation, why is it a remedy? More from a science perspective, what's common sense, but it's good to know what the science says. And then the autosuggestion and healing power and some of the other methods in autosuggestion. And then physical and psychological benefits of relaxation. Of course, we touched more on the spiritual yesterday, but we'll talk some of the philosophical, just touch on them a little bit more, embellishing yesterday's. And some of the posture exercises and particularly the role of silence in this setup. So first one, so physical condition. So the definition and impact of stress. So stress is a word coined by a researcher in the term of the last century, meaning that it's a pressure, you feel a pressure causing discomfort and manifests in anxiety, irritability, or fear. So tension, stress, they're more or less the same, but stress has got some connotation more specific like that. And the effects of stress are emotional strain, lead to irritability, anger, and the feeling of being overwhelmed. So that's kind of a common feeling for all of us in many settings in life. And in some settings, it can then cause more problems. Basically, what the biological mechanism is, a stress triggers the brain and the nerves of your body. And so nerves kind of go to the tissues and cause a response as if they're going to be attacked. And at the same time, your glands secrete a bunch of hormones to then enact that in other ways. You've got a lot of mechanisms to make your systems work and get ready for this. Key ones being the nervous system, its messaging, and the endocrine system, which is your hormones. There are others, but these are key ones that we talk about, particularly in yoga. So, for example, your blood supply to the digestive system is cut back because now you're going to need it to your muscle and your body and your arms. So you can imagine not a good time to digest food. Your salivary glands dry up because, again, the blood flow is going elsewhere. Your respiratory rate increases and faster, so you can kind of react more quickly. The heart rate is faster, there's no more pumping around, so you can actually do things more quickly. And imagine a while if you get cut, you're okay because of blood pumping just to kind of help you if you get injured. And then liver is sending sugar out because you need fuel. So a lot of these are happening at the same time using these methods. That is what stress is, okay? And then what else happens? Well, the nerves that do that are broken down into sympathetic, parasympathetic, and your general nerves. And we'll touch more about that a little bit next slide. But sympathetic system, basically, its purpose is to prepare you for a fight or flight response. So, if you see a tiger, you're going to get ready to run, right? And so if you see somebody who's threatening to attack you or somebody else, you're going to get ready to fight. So it's preparing you, very important in life. And again, this is normal. It's not always going to be disease. And we talked about the sugar and the dry mouth. And then it generates electrochemical energy. And so your muscles get tense, ready to go, prepare for quick action, even to the point where you don't need your glucose. You can even burn fuel without glucose. The counteracting system is a parasympathetic system. That's the one that does the opposite, relaxes and tones the body back. So some of the problems, if you overdo the stress, is of course high blood pressure. We heard the slide above. Indigestion makes sense. Panic, like not just I'm afraid now, but I can't control how afraid I am. So even a tiny little stripe far away might make you think of a tiger, and I'll panic. It could be a zebra, but I'm just panicking. And then you get aches, the muscles and spasms. So you get aches with your lactic acid, your aches in the head, the back, the shoulders, headache. So a lot of systems can be awry because of stress was overdone. All right. So important systems that do that, and we already touched on, is autonomic. It's called autonomic nervous system. And it's very interesting, this, and I think you'll find this very startling. So autonomic nervous system regulates your rhythmic cycles of action, right? So if I'm eating food, parasympathetic, I'm running, sympathetic, it does it all constantly, is balancing, constantly is controlling us. And in yoga, the sympathetic system is called Pingala, all right? And that's one of fight or flight. The parasympathetic is called Ida, which is, you're going to relax. And the regular one in the spinal cord is called Sushumna, okay? What's very interesting is that the yoga, both the Jain and old yoga, says that your Pingala, which is the sympathetic, runs on the left side of the spinal cord, which is Sushumna, and the Ida runs the right side. This is, don't forget, it's BC, right? Patanjali and some Jain Munis. We talk about thousands years ago. Well, it turns out that science is true also. It turns out a sympathetic system is innervated more on that side of the brain, left, and your parasympathetic more on the right side. So it actually fits what yoga says physically and predominantly. So it's really quite impressive how they got it right at that time, right? So as I mentioned, sympathetic system or Pingala Nadi is left-sided, and it prolongs stress, activates a fight or flight response. Somebody's angry, don't bother them, you let them calm down because they're going to fight even more. The system's firing, even if they don't want to, the system is going to take over. And then, of course, heart attacks, things can occur. The parasympathetic generally is better for you because restore back to balance and harmony. But tension has a dual role, right? You need it also. While it causes stress disorders out of control, you need it to survive and achieve and motivate and drive a car and brake suddenly and stop at light. So you need that. So clearly the both time balance is important. If imbalanced, then we work on the one that needs balance. Yeah, good. So now, the next thing we're going to talk about disorders and cause of this tension, which is a slightly looser term to stress. Okay, so clearly sudden lifestyle changes, death, separation, or divorce, things that make sense. So nothing particularly surprising there. Even just changing your lifestyle, retiring can contribute to chronic stress because you have nothing to do, or it can help. There are scoring systems that are used, and certainly at some point we want some, I can send them to you, and they can quantify stress from life changes. And of course, if your score is high, you're heading towards stress illness. So the scoring systems are pretty good at predicting that. There are measures to remedy that we're going to talk about, like exercise, relaxation. Not all are yoga, some other methods, walking with nature. So we'll touch on some of that. And then you also have your protective systems that come to bear. And we have natural mechanisms that will protect us. And actually, yoga and meditation taps into those natural mechanisms. Very important to understand that. Okay. So how do you quantify? As I mentioned, there's a score for life event stresses, which is the Holmes and Rice score, other scores like that. And then also impact of multiple changes. So what happens is many things can happen together, which then needs to execute your coping skills, which sort of taxes your coping skills. So you have to kind of add more coping skills for multiple changes. And that's why exercise, relaxation, of course, sleep, a lot of mechanisms already have a use. What we're trying to do with yoga meditation is to tap into that and very good at it, teach you to be really good at it, and teach your patients or your future clients so you can get very good at it and retain this old wisdom to do that. All right. And we do have, as I mentioned, particular mechanisms we're going to tap into. So that's how we quantify and how we target, which is what we do. All right. Now, relaxation is an obvious one. So let's talk about that. What is the basis? Well, first of all, you're wasting energy when you're stressed out, right? Your blood pressure is high, your glucose released, you're burning, you're breathing fast. So a lot of waste of your own vital force, if you like, which is not going to be helpful for you. Your muscle contractions, you can imagine how much effort just generally you're wasting, because typically most of the situations you're not using it, you're not actually using to fight an animal, you're using to kind of, you're just in stress, right? And burning. So energy waste is a big one. You also then tax your nerves. The nerve cells start getting exhausted and start aging. So you find people who are stressed tend to age more than they would if an identical twin that wasn't stressed. So if you look around, you'll see that's a very, very simple analogy. Like my gray hair is probably from stress, things like that. So stress is, of course, going to age you. And then you will, of course, need to work hard to relax and restore if you don't have help. So by yourself, just to figure it out can be very, very difficult. You'll sometimes lucky break, you might see music, but it's actually hard to do unless you've been taught. So some of these are worth being taught, which is what we're going to do. All right. So one of the major mechanisms that works in stress, which is the yogic and other ancient relaxation methods, is something called the relaxation response that's being used. It's a concept by a Harvard physician, Harvey Benson. He learned yoga in India and Far East, came back, and he kind of coined this term. It's a very helpful term. So during relaxation, you have a response where you reduce your heart rate, relax muscles, slow breathing, reduce blood pressure, and many things can induce that. Right? You listen to music, walking in a nice park can do that. That response is the same whichever way you do it, but of course, if you're good at it, you can get a better outcome for that response more consistently, more often. So basically, that executes your protective mechanisms, and so you can train them. So to train that, you need autosuggestion, which then helps you develop these mechanisms and then help you manage stress. Now, it's a tool you can learn, so you can practice and get good at it, as opposed to natural in nature might do it. And some of you might be naturally good at it. This is you're going to be training somebody, training yourself to do it on demand. That is what this technique does. And of course, once you're relaxed, your glands are relaxed, your muscles relaxed, you can function better, you can start doing things better, you're not wasting energy, and you can get back to base. And there are benefits of doing it regularly because it sets you up your wiring and your DNA and your in the motion where it is protected for a long time. So if you do it regularly, you'll be resilient to the next stress. You'll be protected for a while. So that's why it's such a wonderful thing to do. It has this long-term protection with it. All right. Good. So what is autosuggestion? Well, it's basically mastery of your consciousness, your conscious will. And so you tell yourself in various different ways to relax. So you're not forcing it, you're not getting tense about it, just getting good at it. And this is something that other methods that we'll talk about, like hypnosis does that. And generally, when you do this, you'll get so comfortable that you can do it more frequently. So because when you do it, you feel better and you're relaxed, it further perpetuates that, and you get better and better at it because you're feeling better. So once you're down the journey, you'll start doing more and more. It's not unusual people doing yoga, meditation go deeper and deeper and further because they suddenly started getting this joy from this. And as you can imagine, if it's working, you're going to do more of that. So that's just kind of a good thing. Some of the roots of psychology go all the way back to this, to relaxation and autosuggestion, which used to be in religions in the past. So even the psychotherapy you see now, if you dig deep, see roots from that heritage. With more discipline, more other data, more information, but you still see semblance of roots from this religious or spiritual kind of basis. So it percolates through these Western methods also. All right, so what are these systems we talk about? Well, one, of course, is self-hypnosis, which is how mesmerism started, which is the original name for hypnosis. And Franz, the guy, Mesmer, he coined the word. And so it works, as you know. It doesn't work on everybody. The majority of us, if we did see a hypnotist and they calmed us, we would probably get calmed down. We're willing to, our willingness has to be there, and it works. We do use that even in my clinic when physicians are trained to do mild level hypnosis, and it works for, let's say, irritable bowel syndrome. So clearly, it's a known thing, and it's actually a validated way to treat. It's like if you like, approved by societies as a good therapy. Psychotherapy, going back to Jacques Liebel, is using form of hypnosis and suggestibility as a national health behavior. So they kind of take away some of the hypnotic power, but take a piece of it to help you self-suggest, get your thoughts in your mind, get you to eat, chip away at your anxieties, and then get you better. So psychotherapy definitely has a role. And so clearly these are techniques that are used and medically used and work. And yoga happens to be one of those where it uses autosuggestion. All right. So what are the factors you need to do this self-hypnosis, or beyond that, even what we want to do? You need to be motivated, because without that, even a hypnotist cannot work with you. You have to be able to relax, and you have to have some concentration and be able to visualize. So again, these are not necessarily always easy for everybody, but in this course and as you practice, you'll get good at it. You'll get this firm conviction. You can visualize things, you can relax, and of course then impart in your future subjects. So again, those four are key, and it'll make sense. And visualization is very important to then get you one level closer to which organ you're going to work on, right? So that's your application of which principles we use. And then, of course, there are postures and exercise relaxation. We're not going to talk a lot about that because we talk about the Kairos, but still there are other postures that also work. Just moving, walking can help. And there can be an additive prevention when you do different methods. And of course, if you keep doing this, particularly the Jain version, then frequent relaxation is essential, because you can even go deeper spiritually, because now you're able to cut out the stresses of the current world and then maybe start looking at who you really are. And essentially all the Jain yoga is trying to do is to get to see who you really are and your nature, which is usually more blissful and more powerful. All right. So now, what are the dimensions of Kairos? Right. So we talk about Kairos, which we talked about yesterday. You can see the root of what it is. It's first very ancient, but looking at the other current ones, you can see how they're interconnected and why it works and why Kairos works. Okay. So clearly, Kairos is self-realization through relaxation. So you learned yesterday how you relax yourself. You're the boss. You're telling your body to relax, and that makes it more effective than just, let's say, sleep. So Kairos is a unique asset because you're in control, aware, and the awareness and control relaxation keeps you focused on that, and then you achieve the benefits. And there are two directions of Kairos. One's performed from outside to inside, one's from inside to outside. And again, this is linking relaxation with self-awareness. So you can imagine then you're linking your inside to outside, outside to inside. And there are parts of Kairos which you'll learn where you look at visualization of color. It goes in, it comes out. So there are two parts to that. And then there's discipline of sense organs. So because you're doing that, you're not talking, you're stopping your sense organs essentially. So reducing that sense of pleasure, into touch and color and smell. So you're also toning down your sense organs. And if you think about it, most of your life, those 5 sense organs are the ones we chase. And we're constantly running around trying to appease them and make them, if you like, the feedback from those senses is positive. So spend all life doing that, and that itself is a source of stress. So in Kairos, you're going to tone all of them down, which is one of the reasons that you can free your mind up and go deeper. And of course, you conserve your energy, because now wrist relax, so all the energy can go into your focused attention, which is quite energetic. And and get the benefit. So card surfing has got a supreme benefit because of these mechanisms. All right. And then one of the things that happens when you conserve energy and you change your attitude from your senses to yourself is you're feeling that energy, a real energy in yourself, right? You feel the energy being a higher conscious. You can think deeper, go deeper, and use more of your conscious ability, and maybe even meditate deeper. And as you change your attitude, your habits change. Your old habits, you no longer see you need them. You know, hey, do I need to see that football game every week? Well, it doesn't really change much. So you might say, if I miss the old one, it's okay. So you start getting this inner drive that, oh, I don't actually need to do this. Why am I chasing my tail every week for a team that, will get there one day? So there are ways like that where you start looking at things and you kind of tone down habits. You missed a game, you're not going to get stressed. It's not going to be a big deal. So things like that happen because you're now looking at the real you. And of course, when you're calm, looking at yourself inside, you're immortal, you've got a strong atma, whatever your beliefs are, but you're special. You're connected with external forces or power that you believe. And so then you feel more stable. You feel the generous strength, relaxation, and mental purity, and less agitation. So you get the peace of mind. You get a mental peace of mind. So very powerful. Right? So talk about mental health. Again, we'll touch on in more detail later. We have lectures on with a psychiatrist on psychiatric impact. And so we're going to talk about this in a much detailed sense. Basically, when you're relaxing, quite a few hormones are reduced. So when you're in stress, again, don't worry about the names. We'll go into more detail, but things called ACTH from your brain, the pituitary, CRH from your base of your brain, hypothalamus, and your adrenal gland hormones. They're the ones we use to kind of help manage your stress in a good way. You might need them, as you mentioned, for good things. But if it's excessive, then they will cause you the drain we talked about. When you relax, you reverse all those. And that those specific hormones have purged out of your system, they're flushed out, and then you can get your regular thing. So you can imagine that if I don't have those hormones, I can be more calm, and my stress and health will be better managed. I can address my mental health issues without all those hormones confusing me even more. So it gives that clarity. Good. And then the posture exercise, we talked about relaxation. And pretty much in cards, as you heard yesterday, there are a few postures, there are 3 here, that we like to do because they tend to allow you to stay stable, not worry about falling over, relax, and stay in a position for long enough time to achieve your goal. So these are kind of the postures. Very important to get correct postures. For example, I could be sitting like this, not leaning back, which is my habit. That already makes me feel more focused. My blood flow, my spine straight. I'm thinking more clearly, let's say. So posture is very important. You have to work on the posture, particularly with your patients. Also, make sure you work on the posture because posture is very important. And we'll go over these also. And then, but there are many options based on how healthy they are. You can lie down, sit. So it's not that you can't do it in different postures, but it has to be correct. Then your blood flows better. I'm not obstructing blood from my brain. I'm not like obstructing one side. I'm relaxed. So you can imagine all my system is working without distracting me from my main goal. So posture becomes very important. And then, of course, silence, golden silence, which means you're not getting your wiring fired up with all these colors. You're just relaxed, like the serene on the right. You've got trillions of connections going on in your brain at any moment. We get a second, any moment in your brain, every moment, because that's what makes you work. Trillions of connections with the nerve endings to make the other talk. That's why one way we get all these thoughts to go through our mind. So when you relax, that energy is wasted less. You get better at it less and less. And you get really good at it less and less. So that conserves energy. You funnel energy to other things you want to do that are targeted, not random, but you actually want to do. And as part of that, silence is very important. So you're not talking, engaging. And by saying I'm not talking, doing cards, so you're also now cutting off one part of your reaction to the world, communication. So silence is one of those very important features of cards. Very important feature. Good reason makes sense. Okay. So I'm open to questions. This is basically what you learned about yesterday, some of the basis. As I say, as we go to diseases like high blood pressure, mental disease, we'll go in far detail about some of the pathways. So you should feel some level of medical comfort level. Not so you understand how to treat, but you understand them well. So when you're treating your patients or your clients, you're going to understand what they're on. So you're not going to be confused by what they're doing. And I think that's very important. So again, summary, scientific philosophy blended. The science philosophy is blending here for the goal of Kaiser and integrates what is in science in many ways. Some science that you see now came from these, but then they've taken up additional data research. And so we understand more about the original method based because of what science does. So it's like a mutually helpful. And of course, that and nobody in science knows about deep philosophical insights, but clearly we all understand. We get an aha moment, we feel better. So there's a great role in spiritual, if you like, healing and less stress because of those connections. Stress with benefits we talked about, promoting emotional and mental well-being, and the spiritual growth and enhancement talked about, which is a regular practice and regularity in optimizing, practicing, and practicing is what we need. It's said if you want to be an Olympic athlete, you need about 10,000 hours a year on something. If you be very good at it, but an Olympic, you need 3,000 years on it. So, you can imagine that what we taught in the course is great, but unless you put the hours in it, in any area you feel you will not get that level that we're looking for. So we've got to work at it. But they're very, very trusted by really good people over thousands of years. So these are very powerful tools that will serve you well and your patients well. All right. Thanks very much. And I will stop sharing. And I'm ready for any questions that you may have. And then some of you might have time, hopefully 10, 15 minutes to do some meditation for us.
So, Jai Jinendra.
Jai Jinendra.
So what happens actually physically or biologically, like when we do culture?
So if you remember the image, what basically happens is when I'm in cars, I'm standing there, because I'm focusing on my body to calm it down and just my breathing, as somebody taught you, I'm no longer engaging with the world, right? As I good, I'm no longer engaging my brain with the world. Of course, thoughts will come, you let them pass. I'm no longer talking. I'm not going to want to talk, no longer listen to people to then respond. So now what happens is by doing that and focus myself, all my heart rate, respiratory rate, all things slow down. My skin tension goes away. My muscle tension goes away. When you stay in Kaizen, you're actually completely relaxed, right? You go through relaxation. So now I have literally no waste of energy, no blood flow excess, no strain, no tension, no funny positioning. And then, of course, as you go deeper into your Kaizen, this is just the superficial physical body level benefit, right? None of my senses are really firing. I'm trying to stay controlled. So then you're very calm. Now, you're very rarely calm. You're, as somebody said yesterday, you're like living dead, right? Now you have nothing else. You're basically, Kaizen is practicing death while you. Good way, not in a bad way, it's a good analogy, telling me that I'm doing nothing. Then I still have my Atma, right? My soul. So I'm now engaging with that. I'm engaged with my enemy. And I have no stress, no strain. I'm just an immortal being. And I'm being myself. And I focus on my breath a little bit or other things somebody taught you so that I can stay focused so I don't get distracted. You will relax so much. As somebody may have told you yesterday, even 20 minutes is like 1 hour of sleep. It's so powerful, this. It'll take you a while to be good at it, but you'll sense it within a short time. You'll see exactly what I'm talking about. You'll just feel that relaxation. So
May I say something?
Of course.
Hi, Jai. Yeah, hi, Jai Jitendra. So if we're talking about the physical sensations biologically, I'm gonna give you a little bit more of like a
mental psychological perspective. If we're talking about our nervous system and understanding where we are in our nervous system, we have to first understand what our, I believe Dr. Mehta, uncle, you said that we have our, when we're stressed, we go into fight mode, right? So from a mental health perspective, a psychological perspective, we actually have 4 trauma responses when our body goes into our body mind goes into it. So we have fight, we have flight, we have freeze, and we have fawn. Okay. So in order for us to first understand that we're going into Kayatsarg, we have which would actually be falling into rest and digest, where you're not having any stress. You need to be able to first understand how your body is responding. Body, mind, soul is responding. So are you having a fight response? Are you having a freeze response? Are you having a flight response, or are you having a fawn response? Only then are you going to be able to discern the difference when you're going to go into rest and digest, where Dr. Mehta said you're not going to be able, like, your entire body is just going to feel fully relaxed. And because, yeah, I hope that helps as an addition.
That was very helpful, and the detail you put is very good. And I would emphasize further that one of the important things about these techniques is, and this is a key concept, is experiential, right? I can give you as much theory as I want to listen and look it up and understand as much theory as you want. As Perry mentioned, it's experiential. You then have to practice, and then you'll see, right? And unless you experience it, you don't actually know it, right? It's knowledge, not wisdom. So part of what we're trying to do is, when we give these talks, we just go and practice. And you won't get it perfectly right, then call, ask question, hey, I tried this, it didn't work, what do I do? And then we'll tweak it, right? But what you want to do is practice, and in your mind, by the time we finish or somewhere along the way, you'll be very, very good at it. Just for yourself, these are such powerful tools. And unless you get good at it, you're not going to teach somebody else. So as I say, it's experiential. And some of these things you hear will come out, oh, Perry said this, and I said this. Oh, it makes sense, right? Because this is not intellectual as much as it might seem. It's actually experiential. In fact, the whole journey actually is experiential. What others experience, they told us do it. We learn, we trust them, that's the faith. We apply it as best and honest as we can, because somebody's our blessed guide here who's guiding us. And we apply that. That's folklore beyond for this is knowledge from thousands of years ago coming down to us from an expert, right? She was taught directly by Acharya Mahapragya. So imagine how much experience. So if we just tag on, we then experience and keep asking if you're not quite getting it right, keep asking, not getting it right, we will click that, all of us. And that's what I want you to do, to think about and make yourself great first, and then yes. But to Perry's point, it's a complex area, but work at it and you'll see, and you'll get feedback that'll be extraordinary. So I bet you if you try it, and let's say in 2-3 weeks, we give you some random time to give you a personal experience, you'll be surprised what you're saying. I bet you'll be very surprised what you're saying. It's that level. It's far more impactful than just meditation. Okay, Kayatsarg is far more impactful than just meditation, because meditation could be thoughtful, which is all good. This has got a deeper root to that. It's got a far more deeper root that I feel is more fundamental. So, but play with it. It's awesome. Any other questions?
I have a question about the stresses. Like, if our body is already accustomed to being in stress all the time, how do we know, like, if the sympathetic or the parasympathetic is overworking? And then how does it, like, it's not easy to get into that state for Kayatsarg right away.
No, it's practice, right? I said it's 3,000 hours, 10,000 hours. That's true across mankind. Like anything you want to learn and be good at, you need that many hours. It's just nature of how our body acquires, skill sets that are that valuable. But beyond that, yes. So you can tell sometimes, because typically symptoms of sympathetic activity, right, are fidgetiness, heart rate, palpitations, sweaty, my skin is tense, muscles tense, I can't relax like a rag doll, right? I can't just breathe normally, or in fact, cars, you don't have to breathe specially, just breathe normally, right? And I tend to breathe faster than I should. I can't relax my eyes because I keep opening, shutting them. not difficult. And as a physician, we pick those up very simply, right? We know somebody is more sympathetic, parasympathetic. It's very simple. Nothing mysterious and simple. And parasympathetic is very simple. You know, when after you eat a meal, how you feel, right? That's parasympathetic. It's good for you, and then you feel that, right? And at that time, you know, you're happy. You ate a lot, maybe you're unhappy, ate a lot, but you're happy, you feel good, you know, but maybe stuffed up, but you feel good, right? And you, so not difficult, but understand that the two systems are what we're using very powerfully. Right? You're actually getting very good at controlling this yoga course. You are so good at controlling those two systems, you can do it on demand. You'll get that good at it. If you keep pursuing exercising, much of yoga is playing those two systems and controlling them. And if you remember the image I showed, it comes, the vagal nerve comes down. The vagal nerve is key to many of these symptoms. It controls many of these.
Yes.
And so all of that, you're actually going to be an expert at the vagal nerve without realizing it, or with realizing it, and how to manage that, right? Your gut and your function. So, but as I say, keep practicing, and you'll see. This is not something you want to just read and sit back. This is experiential. It's like going to gym and just reading about the gym, and that looks good, but not doing it. You know, it makes no sense. But this is the same thing.
May I say something again?
Of course.
So I think after the first session, I don't know, I think one of the participants had asked about muscle relaxation or just like relaxation in general. So I had actually sent a link over of an activity that you can do before bedtime, which is called the progressive muscle relaxation technique, which is really good if you want to actually get into rest and digest right before bed, especially if you're like dealing with like insomnia, like you're having a hard time, sleep disturbances and things like that. So the reason I'm saying this and bringing it up again is to answer Auntie's question about how do we know? Because you are right that it's not easy. So what I would suggest is if you are able to just take 5 minutes of your daily time, this is even before you practice Gayatri or any form of meditation, but if you can take 5 minutes of your time and ask yourself, where in my body do I feel the most pain? That is where your stress hormone is active. And obviously this is just one perspective, okay? Because there are many other reasons where you maybe feel aching and pain. So please take what I say lightly to a degree. And that will give you a point in terms of where you may need to focus your attention in order to bring the stress levels down. So now you can do that through massage therapy, or you can do that through any sort of specific asanas where you're going to be able to stretch that. Secondly, another thing I would say is that for me, I'll just give you my example, is that I noticed that I have to work on my shoulders. So if I'm stressed, my shoulders are usually scrunched up. I don't know where I was going with this. I had a point to make from all of this.
That tells you your sympathetic is high. So you're saying that's
yes,
your sympathetic.
Yes, thank you. That's where I was going with that, is that if you are able to just take 5 minutes and instead of like just focus where your tension is in your body, it will indicate where you are, if you're high in parasympathetic, or if you're not high, in inappropriate word choice here, if you're in sympathetic or you're in parasympathetic. And from there, you will be able to navigate what asana you need to do and what meditation technique you need to do and what pranayama technique you need to do. Yeah, sorry, that's it. Thank you. Thank you.
All right. So where we are, I don't know if somebody wants to, we can keep talking. It's up to us, or we can try and see if we can do some meditation. Probably the best thing to do is to, we've got about, how much time? Yeah, about 10 minutes. So it's time for more question, but I would think it's a good time to get somebody to teach us some meditation. Any other question? Anything else anybody wants to bring up or discuss or contribute? This is lovely. I like this.
what's the difference between sleep, Kaiser, and meditation? Like even in Kaiser, my mind might be still like thinking about, so what do I do?
Yeah, I mean, don't forget, we're practicing, right? We're in a journey to practicing. We've done it for a while, and we're going to do some more. So I think, and again, some of you can be a better guide to individually in a group, but sometimes even talk to individually, which you're welcome to. She might give you tips specifically for you because she's clearly the expert in this setting. But what the take I would like to leave you with is that sleep is something where your brain is also, if you like, sleep, right? Your sleep waves in the brain. So you're no longer using your brain to relax. You just let the body relax like a rag doll. A form of relaxation. It's restful. Always do it. We need it from as a baby. Without that, we will get sick. Very restorative. Helps us stay healthy. Very important. What the gurus did, yogis, is figure out that if you actually do it awake with your mind alert and tell your body, you're even more relaxed. Does that make sense? So you're actually commanding every nerve in your body, every part of your body to relax. That commanding is what you get good at. Then you get very, very good at. You can actually get very good at. So see the difference? Very different. Now, meditation, there are many aspects of meditation. Right? Meditation could be just breathing, so you focus on breathing. Sometimes you're going to focus on things to meditate. So meditation is the process. And so Kaizen is like one, if you like, expert form of that. Meditation has many other aspects. Meditate on something, meditate on some item. I can meditate on a light, a color. I can do this autosuggestion. Kaizen is like a part of relaxation and getting into that state. So you can use it as a combination, if you like. Kaizen does have additional benefits at our stage, where meditation you have to be really, really good at to get benefits. Kaizen even cleanses our soul, if you like, if you do it well. With meditation, we've got to get very, very good at it. Another level of depth that which few people in the world probably can do. So, it's one of those things is progression, so different aspects. But if you look at this lecture and yesterday and say, this is Kaizen, you'll be very clear in your mind what that is, right? Postures, positions. And then when you get meditation, you'll see it's with breathing, with pranayama, it's a slightly different form, right? And tackling different parts of the same autonomic nervous system, and you're playing with them back and forth to get good at it. So let's say when you do Anulom Vilom, right? You're engaging both and getting them balanced. It's a different method. Here, just relaxing, parasympathetic. When I'm meditating on a Vilom, I'm doing both. If I do left, right, we already know what's left side, right? You already know from my talk. If I do right, you know what my right side is from the top. So you're engaging both. So now I'm playing both and making them, it's like exercising. I'm exercising both ways, so my arm is healthy, not just one way, right? With Kaizen, I'm actually just parasympathetic. I'm trying to stop sympathetic. I'm relaxing. Make sense? So that's the difference. So as we have more, you get more comfortable, but you can see the power of this tool.
Thank you so much.
Very good question.
So should I use meditation session?
Yes, Abhijit, please.
Yes.
Thank you.
Thank you for your wonderful talk of today. So now we would practice relaxation for 15 minutes. So relaxation is calming down all our voluntary functions of body, and especially to control the sympathetic nervous system, which is hyper in some cases. And because of that, there is some kind of physical fatigue or mental fatigue or emotional tension. So to calm down the sympathetic nervous system and to activate the parasympathetic nervous system is the initial effect of relaxation. And in relaxation, we use autosuggestion to relax our whole body, mind, and vocal cord. Okay, so autosuggestion plays great role in relaxation process. So now be ready. You can sit in a comfortable posture. Keep both the hands in posture of knowledge on the knee facing upward sky. Close your eyes softly. With 5 Om sounds, we would start our relaxation process. So because of the Zoom, the voice would be broken. So you can just recite Om sound 5 times at your place to start meditation. Take a long breath. Make the sound of Om as long as possible. Now relax your body. Make a resolution. I am practicing relaxation to be free from all physical, mental, and emotional tension. I am practicing relaxation to be free from all physical, mental, and emotional tensions. To start relaxation, please concentrate your mind on the big toe of your right leg. See the toe from within. Whatever sensations, functions are going on in the toe, experience all the sensations, all the functions. Give suggestion to be completely relaxed. Relax. Relax. Use the autosuggestion process. It is more effective than any other. Give suggestion to be relaxed. Slowly and gradually, you will see that there is complete relaxation in the toe. Now concentrate on each of the fingers of the right leg. See them from within. See all the functions, all the sensations. Give suggestion to be relaxed. 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 Now feel complete relaxation in the toe and the fingers. Now concentrate on the sole part. Spread your mind in the sole. See each and every nerve, cells, tissues, bones, muscles, their functions. Give suggestion to be relaxed. relaxed, relaxed. See, the soul part is getting relaxed. Now concentrate on the ankles, calf muscle, knee, thigh, up to the hip joints. See the entire leg. See each and every cell, tissues, nerve, muscles, bones. Give suggestion to be relaxed, relaxed, relax. Now feel your entire right leg is completely relaxed. It is becoming very stable, very light. Now concentrate on the big toe of your left leg. Starting from the toe up to the hip joints. See each and every part. Give suggestion to be relaxed. 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 Now feel complete relaxation in the left leg with your autosuggestion. The entire leg is getting relaxed. The lower part has become completely relaxed. Now concentrate on the middle part of your body. From waist to up to the collarbones. See the frontal part. See all internal organs. Large intestine, small intestine, liver, pancreas, stomach, food canal. Trachea, lungs, heart, ribs, collarbones. See the entire front part. Now give suggestion to be completely relaxed. 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 Feel complete relaxation in the frontal part. Now concentrate on the big part. Starting from the bottom of the spinal cord, big bone, up to the top of the big bone. See each and every vertebra, the nerves coming out of them. the entire muscle of the back side. If any pain is there in the backbone or in the waist part, see that also. Concentrate on that part. Give suggestion to be relaxed. 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 Feel gradually the entire big part is getting relaxed. If any pain is there, it is also going away. The body is free from all kinds of agitation, tiredness, stress, or any kind of pain. Now concentrate on the thumb of your right hand. See the entire thumb, all the fingers, palm, wrist, up to the elbow, and up to the shoulders. See the entire right hand. Spread the light of your mind in the entire hand. See all the functions. Give suggestion to be relaxed. 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 Feel complete relaxation in the hand. Now concentrate on the thumb of your left hand. See all the fingers, palm, wrist, up to the elbow and up to the shoulders. See the entire hand. Give suggestion to be relaxed. 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 Now the middle part of our body is completely relaxed. Now concentrate inside the throat. Now we are practicing relaxation of throat, which is very important to relax mind, to stop non-stop chatting of mind. It is also important for controlling the metabolism, the secretion of thyroid and parathyroid. Concentrate inside the throat. See all the organs, glands, vocal cord, each and every cell, tissue, nerve, muscles. See with full concentration and full awareness. Give suggestion to be relaxed. 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 Feel complete relaxation inside the throat. The mind is also getting relaxed. The thoughts are going away. Jetting of mind is stopping with the relaxation of the throat. Now concentrate on your facial organs. See each and every facial organ. Chin, lips, tongue, teeth, palate, cheeks, nose, eyes, eyebrows, ears, forehead. See each and every organ. Give suggestion to be relaxed. Relaxed. Relax. All the organs of the face are getting relaxed. Now concentrate on the brain. Right hemisphere, left hemisphere, brain stem. See each and every neurons, neural connections, the functions of brain. Give suggestion to be relaxed. Relaxed. All the neurons are getting relaxed. Relax. Now feel the brain is getting relaxed. Slowly and gradually, we are coming out of all mental tensions, worries, anxieties, unnecessary thinking. The brain is getting relaxed. Now feel your body is completely relaxed, free from all tensions, tiredness, fatigue. It has become lighter and lighter. See yourself distinct from the body. Even in relaxed state, you are perceiving the entire body. That is you, distinct from the body. You are the observer, perceiver, knower. The body is inert. Now, with 2 long breaths, we will conclude our meditation session. Take 2 long breaths and feel your body is becoming active and you are coming out of meditation, relaxation. With 2 Om sound, you can conclude your meditation. Om. Om. Now meditation is over. So how was the relaxation? Pari? Thank you. Have you got the experience of relaxation? Yes. Anybody else? Yes, very nice. Sheetal. Naina. Okay. Dinesh. Okay. Nice. Purvi. Thank you. So I have already posted the full relaxation guided session. So might be you all are practicing. Yes, it was very relaxing, Shivani. Maybe. So it might be you have already started practicing it, but you should practice continuously and see how you feel after relaxation and what kind of changes you are feeling. So give in feedback. Last time I gave a 4-step meditation for 1 week. Now the relaxation is for 1 week. So you can see that how meditation is affecting your life. Any question or anything?
I think it ends quickly when you say, right when we're at that relaxing state. And
Yes.
it's like you said, take 2 long deep breaths. And I'm like, I want to go on more.
Yes, when we reach to the climax, it is the time of ending.
Yes.
So that should continue from that point. You should continue at least for next 20 minutes. But since the class limitations, I have to give such instruction, but that is not right. It should continue for 20 to 25 minutes after that.
Okay. Yes.
So that's why we suggest that you should practice relaxation for 45 minutes. Then you can get a real experience.
Yes.
So thank you very much. Why all the participants are not attending? And they are in 200 hours are must on a screen. We have to see all the participants.
We'll remind them, Samiji. We'll find out what's going on. We'll remind them. I
Yeah,
think we can do that.
yeah, all have registered in a proper way, so they should attend at least. Otherwise, how they can be trainer in it? If something is not clear, they can ask whenever they are in session. So thank you. Now we have to leave.
Okay, yep. Well, nice, Samiji. Thank you, Cyril, and everybody. That's
Yes.
we'll see you again tomorrow.
Thank you.
Davinam Swami.
Swami, Namaswami. Thank you.
Thank you.
Swamiji.